Ever wondered what thyroid tests are all about? A thyroid test is a type of medical examination that checks the functionality of your thyroid. The thyroid, for those who might not know, is a small, butterfly-shaped gland located in the neck, right below the Adam's apple. Its job is pretty significant considering its size. It produces hormones, specifically thyroxine and triiodothyronine, that regulate our body's metabolism. These hormones control how the body uses energy, impacting everything from your heartbeat to how quickly you burn calories. So when your thyroid isn't functioning as it should, it can throw your entire body off balance. That's where thyroid tests come in. These tests measure the levels of thyroid hormones and thyroid-stimulating hormone in your blood, helping doctors determine whether your thyroid is working too hard, not hard enough, or just right. Let's delve deeper into why these tests are so crucial. Why should anyone bother about thyroid tests? That's a question we often hear, and the answer is simple yet profound. Thyroid tests are essential to our health and well-being. Let's delve into why. The thyroid, a small gland at the base of your neck, is a powerhouse. It produces hormones that regulate your body's metabolism, affecting how fast your heart beats, how deeply you breathe, your body temperature, and even your body weight. When this gland is functioning correctly, it keeps everything balanced. But when it's not, it can lead to disorders such as hypothyroidism, where the thyroid underperforms, or hyperthyroidism, where it overperforms. Now imagine a car engine. If it's not tuned right, it can underperform or overperform, leading to bigger problems down the line. The same principle applies to your thyroid. If it's not producing the right amount of hormones, it can cause a ripple effect of health issues. Hypothyroidism, for instance, can cause fatigue, weight gain, and depression, among other symptoms. On the other hand, hyperthyroidism can lead to rapid heartbeat, weight loss, and nervousness. Both conditions, if left undiagnosed or untreated, can lead to severe complications including heart problems, mental health issues, and in women, problems getting pregnant. That's where thyroid tests come into play. They are designed to measure the levels of thyroid hormones in your blood. These tests can help diagnose whether your thyroid is underactive or overactive, allowing you to take steps to balance it and prevent further complications. But it's not just about diagnosing disorders. Regular thyroid tests can also monitor the effectiveness of your treatment if you've already been diagnosed with a thyroid disorder. It's a way of keeping your health in check, ensuring that your treatment is working and that your thyroid is functioning as it should be. So the importance of thyroid tests can't be overstated. They're a crucial tool in maintaining and managing your health, helping to keep your body's engine running smoothly. Now, you might be wondering, how are these tests performed? Well, stay tuned as we dive into the process of thyroid testing in the next scene. Thyroid testing may sound complicated, but it's actually quite straightforward. Now let's dive into the process of thyroid testing. To start off, the procedure typically involves a simple blood draw. That's right, a small sample of blood is all it takes to measure the levels of various thyroid hormones and the thyroid-stimulating hormone, or TSH. This blood test offers a window into the function of your thyroid, a butterfly-shaped gland in your neck that plays a crucial role in metabolism, growth, and development. So what exactly are we measuring in a thyroid test? Well, there are two main types of thyroid tests, the TSH test and the T4 test. Each of these tests gives doctors a different perspective on how your thyroid is functioning. Let's start with the TSH test. This test measures the levels of thyroid-stimulating hormone in your blood. TSH is produced by the pituitary gland in your brain, and it tells your thyroid to make and release the thyroid hormones thyroxine, T4, and triiodothyronine, T3. If your TSH levels are too high, it might mean your thyroid isn't making enough hormones, a condition known as hypothyroidism. On the other hand, if your TSH levels are too low, it could mean your thyroid is making too much hormone, a condition known as hyperthyroidism. Next up is the T4 test. This test measures the levels of the hormone thyroxine in your blood. Most of the T4 in your blood is bound to a protein, and a small portion is unbound or free. Both bound and free T4 serve important functions in your body. In a T4 test, doctors usually measure the free T4, as it is the unbound form that is available to affect body functions. If your T4 levels are too high or too low, it can indicate a thyroid disorder. In addition to these two main tests, there are a couple of other tests that might be used in certain situations. The T3 test measures the levels of the hormone triiodothyronine in your blood. And then there are thyroid antibody tests. These can help identify whether an autoimmune disease, where your body's immune system attacks its own cells, is causing a thyroid disorder. So there you have it. A small blood draw, a few key measurements, and a wealth of information about how your thyroid is functioning. These tests are a powerful tool for doctors to diagnose and monitor thyroid disorders, ensuring that patients receive the right treatment at the right time. And that, in a nutshell, is how thyroid tests are carried out. Once the tests are done, what do the results mean? A question we often ask ourselves after medical tests, isn't it? When it comes to thyroid tests, interpreting the results is key to understanding the health of your thyroid gland. Let's talk about the three main tests: TSH, T4, and T3. TSH, or thyroid-stimulating hormone, is produced by the pituitary gland in your brain and tells your thyroid to make and release the thyroid hormones into your blood. A high TSH value might mean your thyroid isn't producing enough hormones, a condition known as hypothyroidism. Conversely, a low TSH value might indicate your thyroid is producing too much hormone, a condition known as hyperthyroidism. Now let's move on to T4, or thyroxine, one of the main hormones produced by the thyroid gland. If your T4 levels are high, it could mean you're dealing with hyperthyroidism. On the other hand, low levels of T4 could be indicative of hypothyroidism. Next up is T3, or triiodothyronine, another thyroid hormone that plays a critical role in the body's metabolism. High T3 levels can indicate hyperthyroidism, while low T3 levels can signal hypothyroidism. It's important to note that these ranges can vary slightly depending on the laboratory that analyzed the blood sample. Therefore, it's always best to discuss your results with your healthcare provider, who can interpret them in the context of your overall health. Remember, these test results are not just numbers. They are indicators of your body's functionality, specifically your thyroid's functionality. So if you have abnormal levels, don't panic. It simply means that your doctor may need to do further tests or start you on a course of treatment to get your thyroid back on track. Interpreting these results can help doctors diagnose and manage thyroid disorders effectively. And with this understanding, you can be a more proactive participant in your health journey. Let's refresh our memories about what we've learned today. Thyroid tests, as we've discussed, are an essential tool in assessing our overall health. They provide crucial insights into the functioning of our thyroid gland, a butterfly-shaped organ at the base of our neck that regulates numerous metabolic processes in our bodies. We've delved into the importance of these tests, highlighting their role in diagnosing various conditions such as hypothyroidism, hyperthyroidism, and other thyroid-related disorders. By measuring the levels of thyroid-stimulating hormone, or TSH, along with free T4 and T3 hormones, doctors can gain an accurate picture of our thyroid health. The procedure of thyroid testing, we've learned, is quite straightforward. It typically involves a simple blood draw from a vein. The blood is then analyzed in a lab to measure the levels of thyroid hormones and TSH. It's a quick, relatively painless procedure that can provide a wealth of information about our health. Interpreting thyroid test results can be a bit complex, but we've broken it down for clarity. Normal ranges can vary, but generally, high TSH levels may indicate an underactive thyroid, while low levels could suggest an overactive thyroid. Free T4 and T3 levels also play a significant role in the interpretation. However, it's crucial to remember that only a qualified healthcare professional can accurately interpret these results and make appropriate recommendations. In conclusion, thyroid tests are more than just a routine checkup. They're a vital tool in understanding our body's metabolic state and can guide us towards necessary lifestyle changes or medical interventions. They help us take a proactive approach towards our health, enabling early detection and treatment of potential thyroid conditions. Remember, thyroid tests are a vital tool in maintaining optimal health. Don't underestimate their value.